And what about the acne? Is it your experience that you see a lot of men getting acne in the beginning of their TRT?
Early on, I mean, I did. I think, I noticed the first even couple weeks when I started TRT, my skin was oilier. You could wipe your forehead and just be greased. But then after about 4 to 6 weeks, it kind of stabilized for me. I don't have a lot of issues with acne with as far as percentage of my patients, it seems like, or at least I don't hear about it. The ones that are truly bothered by it or having some really big like cystic acne type problems, I will hear about. And those guys, more times than not, we're able to, they're usually on injections, and we're usually able to switch the carrier oil around to clear up their skin quite a bit. I've had a lot of guys doing commercial cottonseed oil, sesame oil preparations, and we get them on either grapeseed or MCT oil. I prefer MCT oil if we can get it for them. Just seems to be a lot cleaner. And lo and behold, 6 weeks go by and their skin, they message me like, "Hey doc, my skin's clearing up." I'm like, "Oh yeah," because you're not injecting. Everybody's different with how their body responds to those things. Well, you're injecting seed oils into your body, you're probably going to stimulate some inflammatory response if the body like that. So now, when it comes to like hormonal acne, quote unquote, man, that's a trickier one, because some guys, it seems like no matter what, you give them a little testosterone, whether it's cream or injections, they just get acne. And I'm not I'm not going to tell them, no, you don't take Accutane or don't do this or that. I want them to be informed with the risks of that. I mean, we know that again, it's the same thing with taking something for your hair. You have to be willing to accept a trade-off usually. And I think a lot of guys just aren't, people in general don't like that. They want everything to work the way they want it to, and it just doesn't work like that.
Yeah.
There just seems to be trade-offs, and opportunity costs essentially. But yeah, for acne, I would always tell guys, we see these posts in the group a lot. The first thing to look at is if you're on injections, what kind of oil are you using, what frequency of your dosing, all that. If you're on cream, a lot of guys just, we'll check a level and their free testosterone's 50 or higher. It's like, okay, we may want to, I know you feel good, but may want to drop your dose down just a little. You may still feel fine, but it may clear up the acne a little bit. And then also with acne, as you know, they've got to look at every other thing they're putting in their body. They've got to look at their diet. They've got to look at their metabolic health. All those things apply. Other medicines they may be taking. So it's not just a one-trick pony when it comes to acne. I know a lot of people want to blame it on the hormone, but it's not always that straightforward. Obviously, when you start a new hormone and you get acne, it's like pretty obvious, okay, that probably caused it. But you don't know if it's the hormone that caused it or something else in the preparation, especially with injections. So just be sure and test different variables.
Yeah, exactly. I see in our group a lot of people ask me about Accutane. A lot of them are afraid about it. They compare it to the side effects from finasteride, but that's not really the case. There's, I've prescribed isotretinoin because that's the generic name. The molecule Accutane is brand name. Here it's even called raw Accutane. If you microdose it 10-20 milligrams a day, the side effects aren't that bad at all, except maybe for some dry lips. But next to that, there's almost close to nothing really.
Yep. So, yeah. And everybody tolerates it different. I've had some people, they have just a little bit of dry, and other people look like they're losing fish scales off their face. But that's usually probably a dose response relationship there.
It's very dose dependent. That.